Hello and welcome viewers. Good to see you all after a very long time. So today I'm going to discuss about the medicine helleborus niger, and also at the end of the discussion I'm going to do a comparative materia medica where I'll be comparing the symptoms of helleborus with the other medicines. So let it get started. The common name of these medicine helleborus niger is Christmas rose, and the family is Ranunculaceae family. Okay, now moving on to the next slide. Coming to the introduction, you see this medicine helleborus niger chiefly affects the brain. So brain is the main center of its action. Okay, so nervous system is especially affected. There is a picture of mental dullness, stupor, and also it involves cognitive impairment as well. You see, it has got a very important characteristic expression. There is a blank stare, there is a wrinkled forehead, and there is a slow blinking of the eyes. Altogether, what you will get in this medicine is a picture of idiocy. So you have a picture of idiocy in this medicine. The patient gives a blank, a vacant looks, a vacant expression. Okay. Another characteristic is that there is automatic motion of one arm and one leg. This is another characteristics of helleborus niger. Okay, now let us see the clinical context, a few clinical contexts where we can use this medicine. First of all, in homeopathy, we cannot say that this specific medicine is meant for this particular disease condition, but definitely we can prescribe a particular medicine for a disease only if the symptoms corresponds. I repeat, only if the symptom corresponds. Now, our medicine helleborus, it mainly has an inflammatory pathology. Please remember that it has got an inflammatory pathology. That means whatever cases of inflammation that we encounter, helleborus can be indicated if corresponding symptoms are present, like your encephalitis, like you have your meningitis, even in case of your post-traumatic brain injury, in case of your hydrocephalus, in case of dementia, or even in case of severe depression. We can think of helleborus if the symptom corresponds. Now what you see in this picture, a picture of idiocy, nothing but a picture of idiocy, acute idiocy rather I would say. And where did you find a picture of chronic idiocy if I ask you? We have seen that in case of Barretta carb. If you remember Barretta carb, we have seen that in case of Barretta carb, a picture of chronic idiocy, whereas in helleborus we have a picture of acute idiocy. Okay, so there is a state of stupor and apathy. There is a state of stupor and apathy. As I told you, there is a marked mental dullness. There is a state of mental sluggishness. Why is this? Because helleborus acts on the central nervous system. Helleborus acts on the brain. As a result of it, the comprehensive ability of a person is decreased. Comprehensive means the understanding ability, the responsiveness of the person, altogether it is decreased. The patient appears indifferent, unresponsive, and slow to answer the question. Why? Because the comprehension of the person is hampered. The comprehension is hampered. That is why there is unresponsiveness, there is indifference, and slow in answering the question, because the patient is not able to comprehend, means the patient is not able to understand whatever you are asking him. Okay, they may be vacant expression, I told you, a blank stare, I told you. Especially suppose if you are a teacher or a professor and you are taking class somewhere, and when students don't understand and they look at you with a empty expression, with a vacant expression, slow staring of the eyes. Okay, that kind of expression you will get to see in this medicine helleborus. Okay, on the top of it you have unconsciousness. The patient gives stupid answers slowly when questioned. That too, he gives answers, stupid answers, but slowly when questioned. And what you get is a picture of acute idiocy. So we have seen, now we can compare it with arnica as well. In arnica also unconsciousness was there, but what was there, the patient was also in a state of unconscious state, but when we used to waken him up and ask question, the patient used to answer everything correctly and completely, and then he used to go back to sleep or the unconscious state. But here the case is different. In helleborus, the patient gives stupid answers and gives answer very slowly because that central nervous system is affected, the brain is affected, and the comprehensive ability, the understanding ability is affected. Now what you can see in the picture, a deep melancholic state means sadness, deep sadness, a feeling of hopelessness. The patient may feel as if they are beyond hope or they are they are doomed. Okay, so they are beyond hope. So there is a great negativity of the mind is expressed, a melancholic state. Difficulty in understanding or processing information. I told you this. Why? Because the brain is affected, the comprehensive ability is affected by helleborus. The patient may forget what they were about to say or what they were about to do, and they may be seen lost or disoriented. Okay. Next, what we have is the delirium state. Now, we have already discussed the delirium of belladonna. We have already discussed the delirium of hyoscyamus, and we have also discussed the delirium of stramonium in our previous video. If you haven't watched that video, please go back to the channel. You will get that video link to watch that video. Okay, so you see, in case of delirium, these are the common symptoms. The patient is forgetful, the patient becomes irritable, agitated, sleepy, mood swings are there, etc. In advanced stages, I am telling you, in helleborus, in advanced stages, the patient may become mute or speak incoherently because the central nervous system is damaged or is affected. There can be muttering, there can be grinding of teeth or picking at the bedclothes. And there was a term for these symptoms in present psychology. I told you in the previous video of belladonna, hyoscyamus and stramonium, and that is floxylation. Okay, that was there even in your belladonna also, that was there in your hyoscyamus also, but the level of violence was much more. But here, as you can see, there is muttering, there is grinding of teeth or picking of the bedclothes. So violence is not that marked also. Next is that the patient is in a state of unconsciousness, I told you, but when somebody or the attendant tries to feed him cold water, he takes that water, swallows it very greedily, right, and bites the spoon. But again, at the same time, the patient remains unconscious. Now, the slowness in comprehension, that is understanding ability, is lowered. I talked about this in the previous slides as well. The patient takes a long time to grasp questions or instruction. The speech may be slow and the responses may be delayed. Prefers to be alone, to be left alone, avoids conversation and becomes irritable if disturbed. Also, one more point, consolation causes aggravation, which is similar to many other medicines including natrum mu. Okay, now see the modalities. The symptoms are worsened or aggravated from mental exertion, cold air, evening, and the patient is better from warmth, from rest, and importantly, pressure on the head causes amelioration. This is a very, very important point that you should keep in mind. Now coming to the comparative materia medica, very, very important part, or the most important, interesting part, where we are going to compare the medicine with the other drugs. Okay, so helleborus, as I discussed, there is a picture of idiocy, I told you. There is a picture of sluggishness, I told you. Patient is apathetic, patient is slow in understanding, there is a lack of emotional response, unresponsiveness was there, right? Whereas in opium, if you see, it's mainly meant for coma or unconscious state, and it is associated with no reaction at all. Even in Berita carb, or even in your case of helleborus, you see reaction was there, but very slow reaction was there. But in case of opium, you're comparing it with a stage of coma or unconsciousness, there will be no reaction at all. Now, number 3 is your phosphoric acid. Phosphoric acid is actually for those corporate employees who have had emotional burnout. Okay, you will get a face burnout stage due to overexertion of the mind, due to long continued grief or long continued stress. The patient is emotionally drained. All those who are working in corporate office or in the private sectors, they are forced to perform beyond the capacity of human brain. That is why they face emotional burnout, okay, or they become very much saddened. They are affected by that stress, and finally they land up becoming a phosphoric acid patient. Okay, next in the list we have what? Cannabis indica. See, in case of helleborus, we have seen a dullness, but in case of cannabis indica, there is no dullness. The dullness is not there in cannabis. Instead, what we have is the hallucinatory state. In case of cannabis indica, what we have is the hallucinatory state or spaced out states. In case of baptisia, the same kind of confusion or same kind of dullness is there as well, like helleborus, but in baptisia we have physical delusions also. What do you mean by those physical delusions? There is a sensation as if the parts of the body are scattered and the patient wants to bring all the parts together. This is what you have seen in baptisia. Along with the mental confusion, you have the physical delusions as well. Okay, the next what we have is the anacardium orientally. In anacardium, there is a mental conflict and there is a state of suspicion. There is no dullness like passive dullness which we have seen in helleborus. It is not there in anacardium. Instead, there is a dilemma or there is a mental conflict. Actually, the patient feels that in one shoulder devil is sitting, he is commanding the patient to do something wrong, whereas on the other arm, angel is sitting who is asking the patient not to do anything wrong, and patient is confused which will to obey. So that mental conflict or suspicion is there in anacardium, not the passive dullness like helleborus. So that's it for today. Thank you so much for watching till the end. Do like, share and subscribe the video. Thank you.